welcome to my page where I will be discussing the difference between perimenopause, menopause and postmenopause, so you are no longer confused. And just for added measure, I have actually written all of this in my book, The Knowledge, Your Guide to Female Health from Menstruation to the Menopause, but you don't need to get my book. I will tell you right now. So perimenopause starts at around the age of about 40, 45, so for some individuals, it's when you're having menopausal symptoms and periods as well. So menopausal symptoms, it's all over, your body will be affected, because what's happening is we're getting fluctuations of hormones, particularly estrogen, progesterone, and a little bit of testosterone effect as well. So you could get psychological symptoms such as low self-confidence, low self-esteem, irritability, brain fog. You could also get anger that was never there before. You feel tense all the time. You also have difficulty with your sleeping as well. You can get tinnitus, you can get oral changes, so your mouth might not be the same. Also metallic taste in your mouth. You might get dry eyes, you might get thinning of your hair, you can get palpitations, then you get all over body symptoms like hot flushes and night sweats. Then you can also get tingling in your feet as well, or sort of formication as we notice that, and vulval vaginal symptoms such as dryness, soreness, splitting, difficulty having sex. The next time you go for a smear, you might notice it's slightly more painful. Those are all over body perimenopausal symptoms that last for about a decade until you get to 1 year without a period. That is known as menopause. So 12 consecutive months without a period is menopause. Postmenopause is 1 year and 1 day without a period, and you are postmenopausal for the rest of your life. And then that's it. That is literally the biological journey that we go on. It's a normal transitional biological journey that females go on. There is a small caveat for some people that might fall out of that. So they're known as primary ovarian insufficiency. So 1 in 100 women below the age of 40 will go through that as well. Then we have chemical menopause, and that's medicines that we give you that will actually stop your ovaries from functioning. And then there's surgical menopause, when we remove your ovaries and your womb at the same time, pushing you into surgical menopause. So there are different types. So like I say, the youngest that I'm looking after, who's in primary ovarian insufficiency, is 15 years old. Menopausal symptoms is what you need to keep an eye on. Track your symptoms, make sure you're following them. And if something doesn't feel right for you, because you know your body the best, honestly, you really do. I can vouch for you as a doctor that does this. And it's my bread and butter, day in, day out. You do know your body the best. Track your symptoms and then go along and have a discussion with them. We do also know that Black and Asian groups, because of the SWAN study, actually probably go through their perimenopausal symptoms slightly earlier. So between 2 to 5 years earlier than their white counterparts. And that is really important to understand the nuances when it comes to different marginalized communities and their experiences when it comes to perimenopause. But I hope that's been helpful. Yeah, that was a great question, and keep following.